So today I want to talk about a very important topic, and that's slings. And slings have been actually very controversial, especially in the medical world, about their use. And some studies are showing that it's good for our arms and shoulders, more specifically our shoulders. Other studies are showing it's not so much useful, it may even be harmful. So then let's back up a little bit. Why are therapists, doctors recommending that some patients wear a sling in the first place? And that has to do with the prevention of what we call shoulder subluxation. And shoulder subluxation in general terms is basically the shoulder and the bones and the muscles are kind of pulled down and they're out of place from where they are typically normally are. And this can happen after a stroke because of the complications and the decreased activity, awareness, and use of that side, especially in the shoulder. You can actually even feel and test for this is if you put your finger to like the side of the shoulder, you can actually feel the big like empty gap where it should be kind of like squishy and bumpy. It can be like a divot and like an indentation. And this is shoulder subluxation. Some patients have shoulder pain after a stroke. Some patients don't. Some patients have shoulder subluxation. And within even that group, some patients have pain, some don't. You can argue that anatomically, in terms of what's normal, a shoulder subluxation is not good. And we want to prevent it. Whether there is pain or not, we want to prevent it from further getting worse because it's just not like normal for our anatomy and how our, if you were to compare it to your other side of your shoulder, it doesn't have that severe of a subluxation, right? One way that therapists have been addressing this and doctors is to have patients wear a sling. And while this is controversial itself, it's because when we do a research study, a patient has so many variables, right? They may wear it, they may not. And then how can you like back up and say that, well, because they wore a sling, it worked out better compared to someone who didn't wear it. I'm wearing a kind of like a more better sling, so to speak, in that it provides support and it allows for more movement. However, one downside is that it can be very complicated. Like even for me, if I haven't worked with this for like several days, like in the hospital to teach someone how to wear it, it's like, oh gosh, I need to like think about how to put it on. So it takes some kind of considerable problem solving to put it on. And after a stroke, some slings may be too complicated at the time for a patient to be able to wear it, or it may be too complicated for the rest of the time because it's just so complicated to put on, right? So then what's the controversy then? Why is wearing a sling bad? Isn't it good for all cases? And most of the time it's intended for supporting the arm. How a sling works or is intended to work, there are many, many designs. This is called a Rollian hemi-sling. It's one particular type. There is a more like general kind, like one that you see on TV shows, much more easier to put on. And they all kind of work. The general premise is to support the arm, and that's to push it and provide support in the direction of where your shoulder is. Like the pointy part of your shoulder, where it sticks out in the corner, it provides support and lift in it that direction because basically gravity, that's what works against a shoulder subluxation and further complicates it. If I'm sitting like this, gravity is pulling on my arm and away from that shoulder joint. In particular, if my arm were to my side like this, it would pull it downward. And that's kind of what causes that further widening of the gap for a shoulder subluxation. And this is very position dependent. If I were to lay down like on my back, then yeah, shoulder subluxation isn't so much as of a concern because gravity is pulling on my joint downward and towards my bed. But especially in times of when we are sitting up, is kind of when we're more kind of prone to this. So that's why you'll see, and a lot of therapists will recommend wearing a sling when out of bed or getting out of bed. So of course, this is not to condone staying in bed all day to prevent shoulder subluxation, right? We're humans, we're meant to move, and staying in bed, studies have shown, has been kind of like one of the most dangerous things. Like back in the day, we thought bed rest was good, but now we all know exercise, movement, walking, functional activities, and doing things that are meaningful to us, occupational therapy, has been shown to be the better approach to preventing further complications and what's better for our recovery with stroke. So then what's the controversy behind a sling in the first place? Why are some people thinking it's dangerous? Well, even though it's intended to provide that structural support, there's not a lot of conclusive evidence that definitively, I'm not saying there's no evidence at all. I'm saying definitively, just because of the human nature and how everybody's different. We have different anatomies. Our day-to-day is different. We all do different things. Because the complication with certain slings, at least not all slings, but certain slings, at least the kind that's very easy to put on, is it locks up your arm and your shoulder in this particular position all day, at least when you're wearing it. And more times than not, especially when I prescribe this with patients who've had a stroke in the hospital, I see them wearing it all the time, even though it may not necessarily be the patient's fault. Yeah, they may forget about it, but staff may forget about it. Family members may forget about it. It's a lot to remember. We have so much to go on, like to remember to eat, sleep, go to the bathroom, and do our day-to-day, get dressed, shower. We don't necessarily and cannot remember all these things because it's new to us now to remember to take our sling off, right? It's introducing a new routine, a new habit for a patient. Unfortunately, what happens more times than not, especially for you occupational therapists, physical therapists, therapists out there, speech therapists, is your patient wearing a sling way too long? Are they kind of stuck in this position and they could be doing something else, like they could be stretching it out or exercising it? And you as a patient, you may be wearing a sling all the time. You should really think about if you're doing this way too long, because the complication with this is your arm is stuck in this position. It's not being stretched out, and it can cause further pain and shortening of your muscles so that it actually becomes more painful when you do try to stretch it and use it in your future recovery. You're not able to use it as much. So that's the kind of like controversial side when it comes to sling. Patients who are wearing it probably way too long, and it's kind of putting them into this position that isn't very functional. First of all, I'm moving around and probably talking a lot with my right hand, right? With wearing a sling, it's kind of stuck in this position. Not necessarily this particular type of sling makes it do it, but the most common like shoulder sling does kind of lock up your shoulder in this position. Our body's made to move around. It's not meant to be locked up in one place. Yeah, you may wear a cast when you break a bone, but that's only while your bone is in that crucial time when it needs to do that healing, and like the plaster of your bone is like drying and recovering, right? But after that, you want your what do you call it? Cast off. Similarly, we're not really meant to wear slings all the time. It's only meant to do a certain job, and that's to help provide support when their body needs it. A sling is good for patients. If I teach strategies like the seal technique, the mnemonic that I talk about in my other video, it doesn't really work for them. They just can't remember to do it for whatever reason. They don't have that awareness and to remember to attend to their arm and where it's at and whether it's supported or not. The key word for this is support. Then yeah, they can wear a sling and should wear a sling when they're doing certain things, such as getting out of bed. So one situation may be, for example, if a patient were to get out of bed from the bed and to sit into a chair or to a wheelchair, then they can quickly put on a less complicated sling, like a regular shoulder sling, so that their arm is supported, because they have really tough time remembering to account for it and pay attention to it, so that they can actually focus on like other tasks, such as moving and getting onto a chair or wheelchair safely, like where their legs are or how they're actually positioning their body, or grabbing onto things for support, or paying attention to the therapist or the caregiver who's actually helping them. And of course, this is also temporary too. So it's not a permanent prescription of, okay, wear your sling when you get out of bed and get into a wheelchair and then take it right back off. Because patients, the hope is that they can recover and then they get functional use of their arm back so they can account for their shoulder so that they don't need to wear a sling at all anymore. But in that kind of very sensitive time when patients are first learning to get out of bed is a really good time to really think about, especially on a case-by-case basis, if patients meet those criteria of one, not having that mental capacity and remembering to account for their arm, two, it's just like really, really floppy, then they may be a good candidate to wear a sling. For other patients, then what are better situations to kind of make up for this and prevent that shoulder subluxation? And I'm kind of doing that in the video, is providing support with our environment. So this can be with things like a pillow while we are sitting up in bed or sitting up in a chair. Well, how do you provide support in a chair? You can have like an armrest. There are specific kind of equipment for this, like arm troughs for wheelchairs. If your therapist or provider has provided you with that, then use those. Or having a lot of pillows while you're sitting up in a chair or in a sofa.
Well, if you're at a dining table, well, how can you have support for that? Maybe you can support your hand on the table, or at the very least, put some pillows there. Well, how about when you're moving around then? If you're walking, well, we all probably have pants, so a good thing to do is put your hand in your pocket, and that provides some support. You ladies out there, if you're wearing a purse, you can use your purse for support. When I was actually in like high school or my college days, I like to wear those hoodies, right? And they have a little pouchy pocket in the front. Those are also really good. You can put your hand inside of that and tuck it in there. And that kind of provides, while not necessarily the exact same support, it provides some support. It allows you to basically free your arm to do other things. Like in the video that I'm showing, I just finished my brushing my teeth. I don't have to worry about a sling. I use my arm for support, and I'm promoting recovery and awareness of that side. The big takeaway, if you forget every single thing or anything that I talked about in this video, is, especially if you're a patient, and this applies if you're a caregiver too, is to look out for yourself and your family members and friends, whatever. Are they wearing a sling way too much for way too long when they could be not wearing it and stretching out their arm, doing exercises for it, or doing a lot of repetition and using it for more functional activities in their day-to-day life, their activities of daily living, instead of it being in an arm sling all the time. So, as this is YouTube, give us a thumbs up if it was helpful for you, it gave you some tips, provided some value. Subscribe to this channel so that I'm in your feed, and if you're looking out for stroke recovery, you get updates whenever we post those videos onto the internet. So thanks for watching, have a nice day, and good luck in your recovery.